Hi, everybody. I'm Noah Drew, and today we're coming to you from the University of North Texas Health Science Center at Fort Worth. We're producing a segment of videos for the community designed to help give you the information that you need to keep yourself and your families healthy and informed during the COVID-19 response here in Fort Worth. Today, we've got a couple of guests with us who are going to help share their expertise. Uh, Dr. David Farmer is with us. He is the Director of Interprofessional Education and Professional Practice. And we also have Jessica Rangel, who is the Vice Provost for Academic Innovation and is also a registered nurse. So thank you both very much for being with me today. Just want to ask some basic questions about what it is that we need to know about COVID-19. Jessica, we know a lot about it already, but can you tell us a little bit about how it's spreading?
Sure. And I know that's top of mind for everybody, and it's all over the news because it seems like every day the number doubles and triples. And I think it's a fair question. And there's lots of ways that it is spreading. And it's the ones that the CDC has described, the behaviors like we're not doing appropriate distancing from one another. If somebody's sick or has sniffles or coughs, they're still exposing themselves to other people, which it's spread very easily that way. And many will hear the term community transmission, and that's actually a big game changer because what that means is someone became infected with no known exposure to a person who was infected. So that implies there's something in the community that people are picking up this virus and becoming infected. And where that happens, we don't know. We just know that's a game changer, hence the response from Dallas County and now Tarrant County, because we know it's at a new level and it's quite prevalent. So the spread happens when we start thinking things of, okay, kids are out of school. Let's go visit. Let's get the kids together. Let's have slumber parties. Let's go to the park with our friends. It's spreading that way. Even though it feels like that might be an okay thing to do, it's absolutely not an okay thing to do. This is an important time to, again, distance, enjoy being at home or go to the park where nobody else is there and take a walk, spend time with your family, be in the backyard. And I probably already said that.
Thank you. Dr. Farmer, Jessica just talked about spending time with family. Some of us are spending a little bit too much time with family. We've are used to leaving the house and going to work or school, but now folks are home with each other 24/7 around the clock. How can we deal with that in terms of getting along with each other when there's just so much contact with those people that we're living with, our family and loved ones?
My wife and I are beginning to wonder if this is a trial run for retirement. We're both there all day. She's working from home as well. And so I think it's important to be very patient, to realize that sometimes when this happens, it seems like it's only happening to us, but it's actually involving everyone around us. So I think to be aware that everyone in our family is being impacted by this. As we work from home, my wife and I found that we've kind of got to set out our own space in which we can work, where we're not constantly in each other's space or attempted to interact with each other. So we've been able to work that out pretty well. I think be patient, be sure to communicate with each other, and then be sure to set time where you are actually taking breaks and you're spending time with each other, or being tolerant of if your spouse has something they're needing to tell you at that moment, to realize that it's different than it's been in the past. We haven't been directly right there together the whole time. So to be patient, but at the same time to set work boundaries as well.
That makes a lot of sense. Um, Jessica, what precautions do people need to be taking to avoid contact with the virus right now?
Well, very simply, avoid being exposed. And so, what does that mean? That does mean stay home. Stay home. And to the degree that we're all able to do it, even though it's hard not to want to go out and do something, try to minimize your visits to the grocery store if necessary. And then when you go, get what you need and then leave. But practice excellent hand hygiene. And that means you are really getting down in between your fingers. You're getting around your nail beds. Those are important things to do. Disinfecting when you've been out. What that means is even doorknobs, grab a wipe, those wonderful different disinfecting wipes that you can put over your doorknobs and that sort of thing that will certainly help to minimize the transmission. And there's other things, like think about when you're out and about because you have to do a necessary trip, you've got your cell phone out. Did your dirty hands touch your cell phone? And there's lots of discussion later, I know, that we can talk about transmission of not just COVID, but other things on your cell phone. So just be real mindful and make sure you're cleaning any other apparatuses that you utilize. Clean them well. And bottom line, just don't be exposed. Stay away from people who are sick to the extent that you can, and stay away from each other to the extent that you can.